the age brackets for those who go in for these aphrodisiacs are the 30 to 45. And then the second highest were the 18 to 30 bracket. But ideally, aphrodisiacs are something for the elderly, those 50, 60 who they no longer have the strength. I mean, at that age, your system is failing, your blood flow is not as strong. So naturally, you can't even sustain an erection. So that's normal at that age. But it's like now, it's our younger generation that rather are chasing after this. There's even a study where they looked at kids born via C-section and preterm babies. They did it in 10 countries, and they realized that those kids have more genes that are resistant to antibiotics.
Preterm babies?
Yes, okay. Preterm babies and babies born via C-section.
Okay.
So even as you are coming into life, you've already come with some genes that will make you resistant to antibiotics. Wow.
There was a BBC documentary that traced some particular medications to find out where they were being produced. It was a disaster. Like, even those that you find in the best from well-branded big hospitals were issuing them. I mean, when you go, they prescribe them to you. When it traced somewhere all the way to India, it was, and I think I was still a teenager then. Welcome, Priscilla, to the ABC show.
Thank you. Thanks for having me.
All right, welcome. So usually I tell my guests that to get to understand anyone, you need to know how they grew up, what formed their early ages, and what, informed the decisions that has brought them where they are now. So if you can tell us about growing up and how you got into pharmacy.
Okay, so growing up, well, I guess most of my life has been at Abokobi. Well, essentially all of my life. My early life, should I say within the first year, was in Kumasi. But, no one has those memories. So pretty much in Abokobi. My mom was an administrator. She's into HR. My dad is also into HR, but over the years, he was doing a lot of things, so I can't necessarily define. But he has worked at a number of places. He has worked for himself. He did private consultancy. So essentially, that was the life I was in. I have 3 siblings. I'm the second of 4 kids. Yeah, so we grew up in Abokobi, schooled. I had my basic education at ASDA and continued at Victory Presby. And then from there, I went to Holy Child School, yes. And then on to Central University, where I did my bachelor's in pharmacy. Okay. Yes. So essentially, that is
how you grew up.
How I grew up, yes.
So now you mentioned that your dad did a few stuff for himself. He worked as a consultant, moved from HR. It's actually difficult for you to pinpoint what exactly he does. You are kind of turning into you're a pharmacist. I know you run a business on the side, and then you're also switching into IT. Yeah. You think that your dad's nature of work and everything is shaping you, or it's more of your mom's job that is shaping who you're becoming?
If we are looking at it that way, it will have to be my dad, because between the two of them, my mom is the one who has had
the
stable job since, I've only known her to have one other job before where she's working now. And she has been where she is for about 25 years now. Yeah, so she's the stable one. And then my dad is the one who is all over the place. So
I don't know how our parents do that. How they did that. So my dad had worked with one company for almost 30 years, and I'm wondering whether this generation will be able to work with a company for 30 years.
I don't think so. I don't think our generation is built for that. Yeah.
Right. So fast forward, you went to Holy Child, studied science, and then you went on to do pharmacy. The people who read science in my house all wanted to be medical doctors. So I have 3 people in my house who read science who all wanted to be medical doctors, and then ended up switching into doing something else, still within health. I think only one switched into IT. Was it the same for you?
For the most part, it was the same. Once you are doing science, it's also about the work you put in. You go to school, you are doing science. Science students were always the most serious ones, the busy ones. So it's like when you are done, to just all of a sudden switch out of the health space, even if you wouldn't end up doing medicine, it's like when you think about it, it doesn't reconcile. So everyone just wanted to stay in that space. And the number one choice was medicine, of course. I mean, everyone's parents also wanted them to be doctors. So it seemed like the best choice for everyone. Yeah. So
So science because you were smart, you got good grades, or science because you already had a plan in mind that okay, I want to be a medical doctor or I want to be in sciences because I mean from JSS, depending on the grades that you have, you are
Yeah.
assigned courses based on your grades,
The
and
grades.
obviously those with the best grades go to science, and the rest are moved to. I mean, few have the best grades and still decide to do some other program aside science.
yeah. Well, I mean, not to toot my own horn, but I mean, I was one of the best students in my class. So there was that, and then there was, I mean, when I looked at all the options, visual arts, even when we're coming up, everyone was like, if you do visual arts, what will you do? If you do home econs, what will you do when you're done? And I didn't really fancy business as a course, the maths. So for me, that left science as the most logical option, in addition to at least being a good student. So for me, there was no other option apart from science. Yeah,
Okay.
so.
So buying your university forms, at what point did you decide, okay, pharmacy is where to go? What informed that decision?
Okay, so I mean, we all know our Ghanaian university system to do medicine. I mean, your grades must be spotless, but hardly is that the case. So I didn't do poorly, granted, but it wasn't spotless enough for our medical schools.
Okay.
So I didn't get the offer of medicine. I got good offers though, but they were away from the science field, and I still wasn't willing to let go of the science.
Okay.
So at that point, I'd actually given up. I mean, I just left it and I was just moving on with life. And so it was my mom who one day sat me down and was like, she has also been looking at private universities and she has seen Central University offers pharmacy. And we know my auntie's husband is also a pharmacist. He has his own pharmacy. So why don't I do it? After when I'm done, I can also set up my own pharmacy, work for myself, make money. So now I was like, well, I mean, it's not a bad idea. And this is someone I also know, a family. We had been to their house a few times. I mean, I knew they were living good. So it seemed like, well, it was a good option. And I didn't have to stay at home for one whole year. That was also another thing I dreaded. So
I know that
I was like, well, then I guess I'll do that. So yeah. And then I started the program.
Wow. So Central University Pharmacy, and then you're back. So when I reached out to you, the reason I wanted to have this conversation with you is because of, I mean, our generation, fine, your generation is a bit younger than mine, and the way we handle medications now, like
Yeah.
almost everything is sold on social media. Like you can find anything. I mean, now you could order your medication and it will be delivered to you sometime with or without prescription. So I wanted to understand how things are going in relation to medications from someone within this generation who understands how things are going. And I mean, with the whole social media thing going on. So for me, I was telling you that I barely finish any medication, which I know is bad. I know it's bad to start a medication and not finish it, but I also feel to a large extent that it has some side effects on my system. The earlier I stop, the better. But I'm weak or I have malaria, and the best way to go is to get onto malaria tabs. But the moment I get strong, forget even if it was just the first dose that got me stronger, most likely I will. And if you check my bag now, I'm sure I have like 2 or 4 strips of malaria tablets.
You have
that
a
are
whole
really
pharmacy
complete.
in your bag.
Yeah, I have a whole pharmacy in my bag. What are the dangers of someone like me who behaves, I mean, who never completes medication?
Okay, so with medications, usually once for a particular medication, every medication and the duration is supposed to be taken for the strength that's supposed to be taken to be able to properly cure whatever you are treating. So usually once you stop halfway, if it's a bacterial infection, for instance, you've started killing the bacteria. And one thing is bacteria is opportunistic. They are always looking for ways to spread their wings, so to speak. So you've started killing it and then you feel better, the person feels better. But in your system, you are not done with the process of killing the bad bacteria. So once you stop midway, now the bacteria are saying, okay, what is killing me is not coming anymore. So now I've seen what was coming, I've seen how it works. So how can I also overcome it?
Okay.
So you know how human beings evolve, they also evolve. So then they will come up with their own evolution mechanism. Then next time you are sick, you take the same medication. You realize, oh, the last time I took one, I was okay, I stopped. This time I've taken the first day, I've taken the second day. I'm not really feeling it. So you realize that it's getting less and less effective, yes. So that's also what leads to our antibiotic resistance we are facing these days, yes. Okay. So that's the harmful thing. But with this, it's happening inside. So you don't see it as much on the outside. So we are not that worried about it until years down the line, months down the line, when you are facing the consequences. But by then, I mean, you've already done it. So
I deal with migraines. And for migraines, I usually will take the painkiller. So for some time, I realized that almost after a period of time, I need to change the medication that I take, and it has to be stronger. Almost after maybe in a year or two, then I have to take a stronger dose or take more tablets. And now I'm at a point where I'm trying to avoid painkillers. I feel that painkillers are a scam. Like, they make you feel that you're okay, the pain goes down, and after, when the medication wears off, the pain comes back. And here I am. I started with para or Panadol or anything. Now I'm at a point where I need something really, really strong. Why that?
So the thing with painkillers, so for the most part, most pain is symptomatic. It's always as a result of something. And painkillers are symptomatic medication. They are to treat the symptom. So you have pain, we give you a painkiller. We are treating your pain all right, but we are not treating what caused your pain. So in that instance, you take it, you feel all right. The drug has a duration of action. If it's supposed to work for 8 hours, the 8 hours has passed. Then you start realizing, okay, I'm still feeling the pain. So it's not that the drug didn't work. The drug worked, but we have not actually treated what is causing you to have that pain.
Okay.
So until you treat what's causing you to have that pain, then it means the pain will persist. You treat it, you subside it, but then you've not handled the root cause, so it's still going to reappear. So that's why you may feel like painkillers are a scam, but you need to go and then have the actual issue addressed, and then you would see your relief. Yeah.
I mean, then I would say that as a pharmacist, are you in there to cure the root cause, or you are there to treat the symptoms? Because if you're dealing with the root cause, obviously you're running out of business. So are medications out there to actually treat the cause of whatever pain or symptoms you are feeling, or there are different medications and depend on what you can afford or what technology is available to us determines what we get?
So for medications, there are medications that treat the root cause. For that, definitely. I mean, you wouldn't run out of business because we will definitely fall sick. So for that, there are medications that treat even antibiotics, they treat root cause because they are treating the bacteria.
Okay.
So the issue is when you come to the pharmacy, so we are supposed to question you, get a whole history, understand everything that has led you to that point. So in most cases, if it's like there are simple ailments that per the pharmacy system you can treat in the pharmacy, yes. Some that don't require testing, so in that case, you can treat the root cause. But if it's an issue that needs testing, in-depth analysis, then ideally we just give you symptomatic treatment for maybe a few days, then refer you to a hospital. But that is where the issue lies in our system here in Ghana. The referral and then the patient actually going. So you realize that with time, it became a system of how can we best just give you your relief here, such that then even if you don't go to the hospital, you are still cured.
Okay.
So that's why these days you have a lot of pharmacies running the diagnostic tests as well. We had companies like Red Bear, they had a lot of diagnostic tests. They could test for the prostate antigen that is identified during prostate cancer, your cholesterol levels, malaria. So all these things also help. So that at least, even though you don't want to go to the hospital, we are not treating you blind. We still have like a diagnosis and then we can handle. But there are certain ailments that no matter what, you have to refer. So the onus also lies on the patients to obey the referral and then go to the hospital.
Now, I spoke of migraine. So I have a friend who is in Germany who also has migraine. And the first time she reported to she experienced a migraine. She took medication that didn't work. So she had to go to the hospital. They asked what she took. She was told clearly this wouldn't cure. Almost the same thing I have on my desk. It wouldn't cure it. So she was given something. She inhales like twice in a day, took something she drops in her nose. It's like a nasal drop, and almost a year now, no migraine. Me, I've been to the hospital. I think the first time I went, it was attributed to my eye, whether my lens was old, I should get it changed and all that. I'm so backy. There are days where I have a migraine and I can't do anything for like 3 or 4 hours. Is it that the pharmacists here are trained differently or it's just that the medications here can't solve the root cause?
Okay, I wouldn't say we are trained differently. To some extent, some countries will have a broader scope in terms of the syllabus for their training. Even medications, there are certain medications available there that are not available down here. But that aside, the thing with migraines can be very finicky, especially if you don't know the root cause. So something like that, especially when it persists for that long. In the beginning, we can try and handle it at the community level, even a general practitioner. But the more it persists, especially after years, at that point, you should probably be seeing a specialist.
Okay.
Then they would have specialized scans and tests they will run. So that could be where the issue, the difference lies, the kind of doctor she saw. But if over here, you still just go to the pharmacy, I take this, it doesn't work. Even sometimes the way you communicate the problem will not express the gravity of the issue.
Right.
Exactly. So all those factors come into play, yes.
Right. So it's more of the medications that are available where I find myself, who is probably even attending to me. The person is a general practitioner. I'm likely to be treated as, okay, deal with the symptoms and you feel better.
Let's not say deal with the symptoms. Because general practitioners still run tests.
Okay.
But, just like the name says, general practice. So they do everything some, but when you go to specialists, it's like if they are just handling head cases, like in-depth head cases, what they would see or handle, a general practitioner would not handle such cases. So so maybe the same thing I'm telling a general practitioner, a specialist to hear the same, and something will click in his mind differently from what will click in a general practitioner's mind.
Okay.
Yes. And another thing with us down here is even us as patients keeping record of our own history. We don't even know the medications we are taking. We don't know our health history. Yeah. I think I have this. I have what drugs I taking. I don't even know. But outside, even if the patient will not know, at least their system is such that you can have access to all these records. So all these things are part of why our health system is not working really well for us.
How do we ensure that healthcare, we don't carry everybody who is sick and can afford to go outside because we feel our system doesn't really work?
So, in that case, it's also about continuous learning. So in the healthcare space, the doctors, the pharmacists, there are continuous development programs that are run from time to time. So usually, if there are new developments, for instance, they are usually included. If there's a new drug on the market, for instance, you have some of these CPDs to teach about them. It's also about personal studying as well, because there are always new studies. There can be a study that said something in the past and then in recent times. Exactly. So it's about keeping abreast with the information. And the thing with our system is, it's like we, the patients, we don't like to ask questions. So in that case, the healthcare provider will also not provide information. They're on the clock, they're in a hurry. Where next can I get to? So if you are also not willing to ask, they are not willing to talk to you. So that's also part. So they feel like, once this is what is there, and the more you ask someone something, the more inclined the person will be to also go and read on what you're asking them.
Okay.
So once that gap is still there, in as much as they can read, something must lead you to find something. So it could be a question someone will ask, and then you go and research in that direction. But if no one has asked you that question, you yourself, you probably will not think about that. Exactly. So all those things are parts.
Our medical system is something else. There are medications that you can just walk into a pharmacy and get. In some jurisdictions, you probably will need prescription to get them.
Yeah.
So is it a policy problem, or is it just individuals who are out there, and the moment you come in and tell them you want something, they're more than willing to give that to you?
It's a mix. Enforcement is an issue because per the natural order, there are medications that are prescription only.
Okay.
So such medications, you cannot come and use word of mouth to buy it. You must always come with a signed prescription. There are medications where you can serve, like a pharmacist can serve such medicine, and then there are the over-the-counter medicines. So even ideally, when you go to a chemical shop, it's only over-the-counter medications that should be there. So your para, your blood tonic, those basic stuff.
Cough mixture.
Exactly. So those are the things they should stock. But these days, you go into a chemical shop, they even have abortion pills. They have they have everything under the sun in there. So it's also the enforcement regulation. So that is causing that issue. And also we as people down here, we've grown up in the system where, when I was sick, I could walk into a pharmacy, ask for so-and-so antibiotic or a prescription medication is given to you. So now, even if, say, a facility is trying to enforce it, you've come back, last month, I walked into a pharmacy, I asked for it, they gave it to me. Yeah. I've come, why won't you give it to me? Then you start a fight in the pharmacy, whereas you are trying to enforce.
Yeah.
So it's like you are trying to get rid of the bad practices, but even we, the consumers, we are also being stubborn. So, it will cause delay in having a smooth transition such that everything is properly regulated.
Yeah.
So.
When you talk about regulation, and I have a lot of experiences because of the sort of work I do. So recently I took my daughter to the hospital. She had an infection, and then she also had infection and malaria. We came back home with about 7 different medications, and I was wondering, and from experience, I realized that if I go to a private facility, I come home with a lot of medication, way expensive that I'll buy if, say, it could be malaria tablet, but the version they're giving me is more expensive and probably has a higher dose than it would be on a regular polyclinic. How does that work?
Okay, so for more expensive, I'll agree with that. But for higher dose, it's unlikely that the dose will be higher.
Okay.
But more expensive, definitely. A lot of private facilities like to push the innovator drugs. Okay. And usually the innovator drugs are the more expensive ones. So the innovator drug is usually maybe a particular, let's say paracetamol, the first company to discover and make paracetamol.
Okay.
The one they will make and patent, that's the innovator drug.
Okay.
Then everyone else is making theirs based on that.
Okay.
So ideally, that would definitely be the most expensive.
Okay.
Then, and those are also branded. And already in our system, branded things are more expensive than non-branded.
Yeah.
So the same applies to medication.
Okay.
So in a private facility, yes, usually they would want to give you the innovator drugs.
Okay.
And another issue with that is there are some drugs. I remember before I completed, one of our lectures was part of a study where they compared some various number of generic medications. So these are the unbranded ones. And then they compared their actual drug component in them. And then they realized that some had way lower than they were supposed to have. So that's another fear with generic drugs. Maybe you take one and then probably the actual drug constitution in that it's not as high as it should be, or it's not the actual quantity it's supposed to be. So some facilities, to be on the safer side, they just want to recommend only the innovator drugs, so that you know that what you are giving is going to do what it's supposed to do, as opposed to giving something that may or may not work. So that's where it lies. But I mean, some definitely get money hungry and then they just
Give you.
want to push here. Because you also have to look at the patient. Can the patient afford what you are giving to them? Because at the end of the day, you also want the patient to get well. So if you can see that this patient, it's unlikely they can afford this medication, and you know very well that there are some generics that would still do the job, why not offer that to the patient? Because some patients, once they can't afford it, they will go home with the mindset of, oh, I'm going to gather money and come and buy it. But we all know when they go home, they're going to forget about the drug and just forget they even have the problem. So in that case, then you push for the one that you know it's not as expensive, but it will still do the work. But that's where finding the balance between chasing the money and chasing the patient's wellness comes in. Yeah.
Right. I think while we were discussing before we started the show, you mentioned that you are likely to have a situation where the person is just treating the symptoms instead of looking at the cure. And if you find yourself in such a situation, and I come with a headache, I come with a backache, I come with a running nose, I come with a sore throat, I'm likely to have a medication for almost every symptom I came in with. And that probably could be the reason my daughter came back home with 7 different medications. How do we deal with such issues? I mean, as someone who doesn't have a medical background, and if it's me, I mean, a stubborn me might not, I might even tell you I won't take it, so don't give me too many. But this is my daughter, 2 years. There's nothing I can do about it. I want her to get well. How do we deal with such issues?
Well, I think public education, for starters, will go a long way. So let's say all the symptoms you've mentioned, for instance, someone with malaria can present with all those symptoms. You have the headache, you have the runny nose, you have the fever, body aches, joint pains, all of that come with malaria. So you can have someone presenting with malaria and then they have all these. So it's about looking at the presentation of the patient. If those symptoms are not debilitating, the patient can still handle it, they can still do what they need to do. Then you just focus on treating the malaria for the person to get healing. But if it's a case where, the headaches are very bad, they can't do anything, the body aches, then you can add those. But if we do a lot of the public education, so as you are coming in, you know that if you are diagnosed with malaria, usually if you have malaria, it could be that you have sore throat, you have exactly. So as you are coming in, you're already informed. So you know that, in as much as I have all these, it's likely they are linked to the malaria. So once we do the test for the malaria and we confirm it, then you know that, okay. So then if they are offering you all these options, then you can even tell them, the body pains, it's not severe, the headache is not severe, so I can forgo the painkiller. Just treat the malaria for me. Okay. Exactly. And then I want to say patients also read wide, but then that comes with a problem because we all become internet doctors. Yeah. Everyone goes online, you see, and then the rabbit hole is endless. Yeah. You see headache, by the time you realize it has brain cancer. Yeah. So that's also the vice with reading wide. So you go, you read, you see something, and then you diagnose yourself even before you come in. So even as much as you are reading, you should also know how to balance it. It's not everything. I mean, at the end of the day, we have doctors for a reason. If everything is online for you to get access to for yourself, then we'll just open only pharmacies. Then you read everything, come and collect your medicine and go home. But that's why we have all these healthcare practitioners in the system.
I think for us, we are lucky because when you are able to read, you're able to find medications. You're actually able to even find reviews of medication, what they do, side effects. You can find out if only you are willing to. But then comes the problem where sometimes you even kill yourself before you get to the hospital. So you have a migraine or you have something and you think that this could be serious or worse, far worse than it should be or it could be when you go to the health facility. But how do we ensure that even we as patients who are going out there to seek healthcare and make sure that when we come, that we are coming in because we want to get better? How do we come in well informed? If we should we check online but still be open-minded, or we shouldn't check online at all?
So I think, you check but be open-minded. So you know that these are the possibilities. The thing with the internet is giving you every single option that there could be. So you could just fall under one of the options. It doesn't mean that you have all of them, or it doesn't mean you have the worst or the best. So read all right, but still have in mind that the practitioner you are going to see went to school. I mean, if you take a
Trained for
doctor,
that.
exactly.
Yeah.
So you should be more willing to take their word for it, especially in the case where they are the ones seeing you and examining you, as opposed to what you are just reading. Because what you are reading is tailored to everyone. But someone seeing you, I mean, you should feel more secure in someone seeing you and telling you have this, as opposed to what the internet is telling you have. Yeah.
Anyway, I mean, I'll keep part of those thoughts in my head. The other part that I also wanted us to look at is that, so for now, there's a lot of medication, or there are a lot of medications that are being sold online. You could easily get access to medication. Sometimes you send your prescription, your medication will be brought to you. This, yes, is good. You could easily get access to medication timely when you need it. But it also comes with its own side effects. And earlier you said your uncle, who was a pharmacist, who had his own pharmacy, was one of the reasons why you considered doing pharmacy, because it was. But now, fast forward, it doesn't look like you'd want to set up a pharmacy, because, especially in Accra or in Kumasi, because of the challenges that come with it. How do we juggle the two and ensure that there's a balance?
So with the online space, when it comes to medications, with that, I mean, as of now, the Pharmacy Council, PSGH, they are coming up with a regulated online pharmacy system. So in that case, it's going to be such that you send in your prescription, whether by picture, to the pharmacy's portal online. They'll assess it and then they'll deliver your drugs to you.
Okay.
So there's that. But there are also still pages online that sell any and every form of medication. So in that case, that's where the body like FDA comes in, the regulation. Because for one, I can't even say where they got these medications from. And then even with the herbal ones, you see that a lot of them, you come back and they don't even have any registration number. So it's about how they can find a way to regulate those pages. But when it comes to the pharmacy space, I mean, everything is being done by the book. So if whatever you're getting is from an actual online pharmacy, that one you have nothing to worry about.
Okay.
But it's all these extra pages selling everything. Those are the ones we need to be worried about, because for starters, we can't even guarantee the authenticity of what they are selling to you. It may be something you get in your pharmacy, but there is no telling whether it's an authentic drug or not. So that is where the issue is. But now everyone is exposed to the online media, so we all have the access. But I think FDA has to do more in terms of cracking down on these pages, ensuring that they follow the right procedures. I don't even know if they'll even be licensed to do something like that. I don't think so. So all that comes into play. So you should know as a consumer, even if you want a medication, I think you should be even more worried about the source of the medication you are getting.
That's true.
So if you are that blasé, you're unconcerned, then in that case, I guess you go to those pages to get your medications. Otherwise, you should have no affiliations with such pages.
I remember growing up, there was a BBC documentary that traced some particular medications to find out where they were being produced.
Yeah.
It was a disaster. Like, even those that you find in the best, from well-branded big hospitals were issuing them. I mean, you go, they prescribe them to you. When it traced somewhere all the way to India, it was, and I think I was still a teenager then. So now I'm wondering what is going on now, because now any kind of medication you are likely to find. You find some girls selling anything, some boys selling anything, especially when it comes to, aphrodisiacs, contraceptives. You find just anything online if you want. And I'm looking at how people can educate themselves. What signs should we look out for to know that this is good medication or this is bad medication?
So physically myself, I haven't seen a fake of a drug before.
Okay.
So in terms of physically being able to tell, even I probably may not be as informed on that.
Okay.
But I think the main thing will be to focus on the source, first of all. Because even I remember I was in community practice, and even in that space, there are some customers who come in. They've come into a reputable pharmacy, but they are even still worried about the source of the medication.
Okay.
So at least that's a good worry to have. So as opposed to just being open to any and everything. So you need to be concerned about the source for starters. And as to, so say from India, so the mishap happened in India and then it came here. In that case, everything that comes in medications, everybody is supposed to test them and approve before they are released into the system.
There's the samples.
Well, well, true.
Yeah.
But I mean, the samples are randomly selected. So let's at least give them the benefit of the doubt.
Okay.
So all this testing is supposed to be done before it gets into the system. So once all that's approved, then they get their registration number. So I think one major thing to look out for is the registration number. Okay. But then I guess in our system these days online, once you get a picture of even the authentic drug, you can easily print it. So then it still comes down to the source of the medication, because someone locally can have some pills illegally sourced. They'll just print the authentic box, put it in.
Okay.
So even if you are going to check from the packaging, you wouldn't be able to tell. So in that case, you should be focused more on the source. That's the best alternative to guarantee that you are getting authentic medications.
All right. So let's take a typical household where there's a man, there's a wife, and then maybe kids.
Yeah.
What basic medications should we keep at home as first aid that everybody could run to? How should it be taken to ensure that we don't end up building our systems in the way that they end up fighting the drug instead of working for us?
For us, yeah. So I think typical first aid, you can do some paracetamol or even some ibuprofen for the stomach. Even the regular mist trasilicate, yes, that's also a good option to have. Or even the antacids, because I mean that's something that can happen to anyone where you get heartburn. So something like that is good. And you can have your wound dressing stuff. So maybe an antibiotic cream for when you have wounds, and then your plasters. So those are the standard things. For those ones, fine. So that, I mean, if you're at home, you happen to have a headache just out of the blue, in that case, and it's very bad, you can take your paracetamol, get your relief. If it's a stomach issue, you have that. Then if it persists, then you go to the clinic or the pharmacy. But I can't say have antibiotics. I mean, at that point, then you are introducing yourself to resistance. Yes. So antibiotic is not first aid.
Okay.
So painkiller is first aid. Constipation relief, first aid. Diarrhea relief, first aid. So just those are good enough for a household.
Okay.
So you know that at any point in time, those things you can tackle while you go and receive the care you need. Yes.
Okay. So let's say someone like me, malaria is fine. So I have malaria, then I'm given a dosage, like I'm given a whole strip that I'm supposed to finish in like 3 days. Yeah. And I do 2 days, I have 1 day left. So I have 1 day left for this particular one. I probably have some
next
2 days
course,
left.
yeah.
So now
when I
have malaria, I have a new flu course.
Yeah.
Is it something that we should do? I mean, one, I know it's bad not to finish medication, so that I'm not encouraging anybody to do that. And some way, somehow, I try to do herbal when I stop. So malaria medication gets me weak. So that's the reason I usually want to avoid it, because then I'm not able to do so many things I want to do. So that's why I run away from it. Then when I'm done, I get onto herbal, something that I cook or something that I trust. But is that something that should be done? That I have this medication, the day I had these symptoms or I had this pain from here, I was given this at the hospital. So I have the rest down. Anytime I feel that kind of pain, I go and catch. That becomes more like I have a whole drugstore. Is this something that should be encouraged, or once I don't finish it, I should throw it away?
Yes. So for starters, if you're a good patient, you shouldn't even have those spare courses sitting there. So we'll start from there. So a good patient shouldn't have that in the first place. But in a case where you do, even now, we are trying to move into a system where we treat, like we test the malaria before treating. It's no longer a case of, oh, I know how I get my malaria. So once you see those symptoms, then you rush and you take it.
Yeah.
We are trying to go back to test and be
Test
sure
and
before
treat.
you treat. Exactly. So that you know that you're actually treating malaria. Because another thing with malaria is its symptoms, it has very generic symptoms. Almost every condition, you can have those kind of symptoms. So what's the guarantee that it's actually malaria? So why not just test first before you treat it? So the rapid tests, it seems most do give false positives and false negatives. So in that instance, the best thing to do is to go to a lab. I mean, these days, even the blood draw malaria test, you should get it in about 15 minutes.
Okay.
So then just get a lab, do the blood draw. That one, if it's negative, I mean,
It's negative.
it's negative. There's no two ways about it. So then you should rather adopt that system as opposed to still doing the rapid diagnostic test, because already you don't even trust it in the first place. But then, so once you go to the lab and you do it, that one is definitive. So whatever it says, then you know that if you have it, you're actually treating the malaria. Yeah.
All right. So you mentioned that antibiotics are not first aid.
Yes.
And that's one thing that a lot of people, I feel, that abuse. Because I was telling you that the documentary on the BBC recently mentioned that even kids are now resistant antibiotics because of the way they are taking them. Some because of the quality, but mostly because of the way they are used. How do we deal with that?
So naturally, I think for antibiotic resistance, it's multifaceted. For starters, maybe in our system, it's not as bad as it is in the West, where even their poultry, their animals, they are given antibiotics and all that. So all these things are also introducing antibiotics into your system. So it's like, as we go through life every day, we are to some extent trying to build resistance even without knowing. Then now to come and add taking antibiotics recklessly. Someone has a cold, then you jump to antibiotics. But a cold is viral.
Okay.
And viruses are self-limiting. Viruses cure themselves. So with viruses, they run their course, they are done.
Yeah.
So once you have a cold, an antibiotic should even be on your mind. But in our system here, once someone has a cold, last minute cold, me go far away, and they call it, you see.
Yeah.
So to them, that's their only solution. But a virus will cure itself. Even if you don't take anything, it will cure itself.
Okay.
So even sometimes, I like to tell people, so far as the symptoms you are having, if your nose is running, if it's not bad, such that as you are walking, your nose is dripping,
Right. Okay.
you can even just leave it and let your system
Deal with it.
clear it. Yeah, that's why we have our immune systems.
Okay.
So some things you don't rush to treat. Yeah, so in that case, you let it run its course. There's even a study where they looked at kids born via C-section and preterm babies. They did it in 10 countries. And they realized that those kids have more genes that are resistant to antibiotics.
Preterm babies or?
Yes,
Okay.
preterm babies and babies born via C-section.
Okay.
So even as you are coming into life, you've already come with some genes that will make you resistant to antibiotics.
Wow.
So imagine, and then you get exposed. Sometimes you have an illness, you go to the hospital, you're there for like 2 weeks. You get exposed to all these things in the system, the food we eat, the water we drink. There can be antibiotics in them, like I was saying about the poultry and the livestock. So all these things are building up, and then we are getting resistant. The medications, you take it halfway, you leave it. Like I was saying earlier, the bacteria, they are always looking for ways to evolve. So they're always looking for ways to have the upper hand. So once you give them the chance, they'll also take it.
Okay.
Bacteria are very opportunistic. You can have bacteria on your skin. We have bacteria that lives on our skin. And then it just gets one chance, enters a part of your body. The next thing you know, you have a very serious infection. Yeah, and it was just bacteria that was on your skin. You were going about your daily life with it. So that's how dangerous bacteria can be. But it seems with that, because we don't see the consequences immediately, we are not willing to be proactive and take the steps to actually prevent it.
All right.
So
I had an interview with a lady who mentioned that most of the things that we seek to cure with medication, we could cure with food. those are the things. And I also mentioned that I don't see why. I think I've told you this before. I don't see why I should go and buy vitamin C if I can have access to orange.
Right.
So these things are there. There are some natural remedies that we could actually practice or put in place to make sure that we don't always have to run to the pharmacy to get medications. What can you recommend are the basic things that we should be able to do with the things around us?
Okay, so I mean, with your point is valid with the vitamin C, for instance. The only issue with that is the concentration. So the drugs made in the labs, we've discovered that this helps to boost your system, but at what dose will it do that? So for instance, if your vitamin C 1 gram, one orange will not give you up to that 1 gram. I don't know the actual statistics, but it will take a certain number of oranges to even give you what that 1 tablet of vitamin C will give you.
Okay.
So it's good. I mean, if you are taking it daily, so you are getting it in small dose, you are getting it from your food, you are eating your kontomire, you are getting your iron, you are getting your B vitamins, you are eating your oats, you are getting your fiber, your beans, all those things. You get all these vitamins, all right. So those are things you can do naturally to boost your natural vitamin levels. Because there are actually some studies that say that even the multivitamins, they may or may not actually help. So that's why the main thing should be your food. Just that there are some that definitely you won't get the full quantity you need from your food. Then you top it up with the medication. Just like for pregnant women, you take the folic acid because you don't get all of it from your food. Yeah. But on a daily, once you are taking those things, then definitely you are building your natural stores of these things. You are boosting your immune system. So once you have these slight attacks, you realize that your system quickly will get to the rescue and then will solve the issue. And then you don't need to, it doesn't even reach a point where you have to seek medical attention. Yeah.
We're doing some work in the community and we ran to a pharmacy, a chemical shop. I think it was a Sunday. So we're checking on whether they sell contraceptives and all that. The man says he has, but he doesn't sell them on Sundays. So jokingly we asked whether you would want someone to give birth to a baby they are not ready for and bring them to suffer, or prevent them from bringing a baby into the world that will come and suffer. So, and this brings me into a conversation around contraceptives. Earlier, I jokingly said that the only medication that people stay clearly to and make sure that they follow the prescription is contraceptives because they don't want to get pregnant.
Yeah.
What is your take on that, especially emergency contraceptives and then contraceptives in general?
So our system down here is also an issue because we are very religious. So it's sort of frowned upon to be having sex in the first place, not to talk of now trying to take a contraceptive. So that's why you have a case of someone saying they won't sell a contraceptive on a Sunday.
Yeah.
There are also pharmacies where you go to, they don't even want to sell a condom to you and all that, yes. But in such a case, I don't think it's right because you should be able to put your religion aside from your practice and then give the patients what they need. So with the issue of contraceptives, over here, I think we are not as informed as we should be. So you realize that we rely more on the emergency contraceptives than other methods of contraception. The emergency contraceptives, they do work all right, but they do have a limitation. A lot of them at most 6 times in a month. That's how many times they should be taken. But you'd see someone almost every week, they even take 2, like the puppets, like like vitamin C.
Okay.
And it's also about the education. A lot of people feel like that's their only option down here. So you see that's the only one they are falling on. So I think we need to focus more on the education as well. Because the contraceptive, there are many options available, both to men and women. Granted, the women have more alternatives than men, but there are still a lot of options available.
Okay.
Yeah.
For men, I know there was a study being done about contraception for men, or contraceptives for men, and then it came with a lot of complications. I think when they were doing the trials, a few of the men who took it had is it rashes, razor bumps, and all that? And that's about maybe a decade ago. I don't know what improvements have been made now and whether they're actually really on the market. And
Yeah.
the way men are paying bills, I'm sure that if there are contraceptives on the market, it really will be helpful. So what's on the market for men?
For men, to be honest, it's mostly the condoms and the vasectomy.
Vasectomy is for life.
Yeah, it's reversible.
It's reversible?
Yeah.
Okay.
It's not always successful, but it is reversible.
Okay.
Yeah, it can be reversed. Just naturally to take time for you to go back to before, but it can be reversed.
Okay.
Yeah. So, especially for married people, they can consider that alternative, especially if you've had all the kids you want.
And
Yes.
then you don't want
For the unmarried, you can advise him to take,
Okay.
to go for vasectomy. That one,
So there are no tabs for men, medication?
No, for tablets for men, no. Unless it's now in development and I don't know about it. But as of now, there are no contraceptive tablets for men. It's mostly the women who have the variety of options. We have the daily pills, we have implants, we have IUDs, we even have vaginal rings.
Oh.
Yeah, and then even women have the option, the vasectomy equivalent. But a lot of people feel like men should be the ones who are taking more of the contraceptives than women.
I'm sure that a category of men will agree.
Yes, because a man can impregnate 10 women in a day, but a woman can only get pregnant once. So
it should rather be the men taking
yeah,
the
so people feel that way. It should be the man being the one taking the contraceptives.
There are a lot of aphrodisiacs on the market for men. And usually you find them being herbal. Sometimes you have these drug peddlers carrying all sorts of things around being aphrodisiacs. And you hear stories of a man went somewhere and died on a woman, and you don't know what people are doing to themselves. Are these things that men should be encouraging, or they should just check their way of life?
Well, I definitely wouldn't say that it should be encouraged. So there was even a study done in Kumasi, I can't remember which year. And as at the time of the study, the age brackets for those who go in for these aphrodisiacs are the 30 to 45. And then the second highest were the 18 to 30 bracket. But ideally, aphrodisiacs are something for the elderly, those 50, 60 who they no longer have the strength. At that age, your system is failing, your blood flow is not as strong. So naturally, you can't even sustain an erection. So that's normal at that age. But it's like now, it's our younger generation that rather are chasing after this. And I don't even think they have issues lasting in bed per se. I think it's more because of the environment we are in now. It's like everyone is now more sexually open. So it's like I don't want to blame the women, but it's like now everyone has room to ask for what they want.
Women are asking for more.
So as compared to those days where you, the woman, you just take whatever the man can give you. Exactly.
You get one, you get two, you are lucky. If you get three, you are blessed.
But now the women are telling you what they want, do it this way. That's a good thing for sure. But then it's translating into that pressure on the guys. So now you see the young guys rather going for these things. And a lot of them, erection is about blood supply. So it's the blood that flows there to keep it hard. So a lot of them will target increased blood flow to sustain it. But in doing that too, you can increase the pressure, your blood pressure to a damaging extent. Then that's why you have cases of men dying on their women during sex, because in that case it can lead to heart failure. You can burst a blood vessel in the heart, in the brain. So that's where the issue comes in. And a lot of these herbal ones, even when you read studies on them, it's like they don't even know where to stand in terms of the studies, whether they work, whether they don't work. So there was even a study I read recently. They were saying they believe it's more placebo effect. So in that case, you've told yourself it will do it, so it will do it.
And it's doing it.
Exactly.
In your mind.
In your mind, it will do it, so it will do it for you. But with these things too, it's also about tolerance. You take it this time, you lasted 2 hours. The more you are doing it, the more your system is acclimatizing to that setting. So now it gets to a point you are taking it, even the 2 hours you are not reaching, then now you are searching for the next best one. I mean, so then you see, so then it becomes an endless chase. So that's why now you see everywhere. And I mean, demand and supply. So the suppliers too are bringing them for you, yes. And even some of them, I think some of them are just marketing.
Okay.
I don't think all the ones that are being advertised are actually aphrodisiacs. Some of them are just marketing. But I mean, the men still want them, so.
The men want them, or the women are making the men want them.
Or they want them on their own.
They want them on their own.
Adding.
I think there are also products for women also. So of late you find different products for women.
Yeah.
To do all sort of things for women. Do they work?
I see some of them and they talk about they'll make you wetter and they'll make you sweeter. I mean, a lot of them, the herbal-based ones, mainly they are increasing blood flow. And for a female too, the clitoris is almost like a penis.
Okay.
So it's also about blood flow to increase the sensitivity over there. Just that it doesn't look as big as a penis, but it's the same sort of mechanism. So in effect, most of them is blood flow they are increasing. Some of them will balance your hormones. So in that case, it's to increase the libido.
Okay.
So what I can say is, fine, if your libido is higher, so you are more aroused, so you can get wetter. But as to it is the drug that is directly making you wetter, no, because it can be someone who naturally doesn't get wet on their own, even before the drug. So if they take it, I don't think they'll get wetter. So, it's all marketing, but as to what the drug itself is doing, it's not, even the studies are not sure where they stand on them. So
the challenge also is that, so some of the herbal medications, we are told they have the orthodox medication, so they boil some herbs, then they add the orthodox ones to it, and then it makes you feel that they are functioning. So you don't know what dosage they're even putting in this herbal medication. And
that is also very dangerous, because already, ideally, you don't mix orthodox medications with herbal medications, because there can be a lot of interactions. There are lots of drugs they interact with, even the food we eat. So to take a medication, an orthodox mixed with something, especially in the case where you don't even know what herbal medication it is, you don't know the quantity in it. That's another major issue with the herbals. You don't know the actual quantity of the substance that is in there.
Yeah, that's the problem.
So, and then to now add it to the orthodox medication, because if it's Viagra, if it's 50 milligrams, so does it mean that medication has the same 50 milligram plus whatever you're adding to? You should be very scared to use something like that. But the men want.
When you say the men
I'm blaming the men.
The men are not using it for themselves, they're using it for the women.
Yeah. They also feel proud when they last long. So essentially, it's a two-way street. So.
All right. So for contraceptives, aside for aphrodisiacs, aside the ones that the drug peddlers carry around, they see you, they move to you, but they do all these things. Can you actually walk to a pharmacy and get, Viagra is on the market, you can get that. Are there good ones that you say, okay, these are good, they don't have a lot of side effects, or even the ones that you consider good have their own side effect? And if you're taking it or you're young and you start taking it at an early age, the likelihood of losing your potency or even your strength at a younger age is higher than not using it at all.
Yeah, so everything has a side effect. Even your anti-malarial drug has a side effect. Yeah. So there's never going to be any drug that we can say it doesn't have any side effects. So that's one thing too about patient therapy. It's individualistic. For someone, they can take an anti-malarial, they'll get headaches, they'll feel weak. Someone can take it, they'll feel fine. So it all depends. So to walk into a pharmacy, that's advisable. But in that case, we'd have to take into consideration your past history. If you have any outstanding medical issues, if there are any drugs you're already on, then all these things will have to be assessed before we can say, okay, I'm recommending this particular one to you or not, whether it's going to be orthodox or herbal. So even usually in that case, a lot of the time, you realize those who take the orthodox aphrodisiacs, if we can even call them that. They are
Okay.
technically not aphrodisiacs, but you get what I'm trying to
Yeah.
say. Those who take the orthodox ones, usually they are prescribed from the hospital. It's hardly you find someone just walking, unless maybe they got a chance to walk into a pharmacy and then someone gave it to them. But ideally, for the Viagra, those ones, they started on a prescription. And then, so in that case, it means the doctor has already assessed if they had any issues already, if there's someone who already has heart failure, hypertension. You can't just be sitting in your pharmacy and the person will come and say, oh, I'm not able to perform. Then you just pick it and give it to the person.
Well,
You can
so
kill
it's a
the person.
prescription-based medication.
It's not necessarily a prescription drug, but you have to take all these things into consideration because it's about blood flow. Even stroke, if your blood flows at a very high pressure, a vessel can burst in your brain, you end up with stroke. So it's about the possible consequences of the drug. So it's not an over-the-counter medication, but it can be gotten without prescription though. But usually it should come from your doctor.
Wow.
It's the herbal ones that I can say that you can walk into a pharmacy and then someone can prescribe. There are some that, they are registered, they've gone through the due processes. So in that case, you can walk into a pharmacy and then you can talk it out, and then if you are okay to take it, then it can be recommended for you. But usually with that, it's definitely going to be the older people.
Okay.
Unless you are just after collecting the money, that's when you'll be inclined to give it to the younger people, because ideally they shouldn't need it.
Wow. Yeah. There are also all forms of spray, cream, that kill sensitivity. Do all these have effects?
So the thing with the sprays, usually it's just lidocaine. Lidocaine is just to numb. So the sprays are topical. They just work on the skin. So for that, you just spray it. It's just supposed to numb the place. And I think even with that, a lot of people don't even know how to use them appropriately. That's one issue. So, and it's hardly that you find someone walking into a place and even willing to wait to be educated to use something like that. They always just want to be as quick as possible. Yes. Sneaky, get it, and then just rush out. Yes. So people are not even using it well. But ideally, because it's topical, in that sense, there's less risk of side effects as opposed to the ones you take orally.
Okay.
Because it has a duration of action it will numb the area for.
Okay.
So with that, in as much as some can be absorbed by the system, it wouldn't be to the extent where it's being harmful. Unless you are using it every day and you're already abusing it, you're not using it properly, then in that case, we can look at.
The issue of emergency contraceptives, let me go back there again, where people say you should take maybe just one dose in a month or X2 in a month. Is that the case? And if people attribute fibroids to, so sometimes they say, oh, emergency contraceptive be brain when you have fibroids. Are there side effects? Can you relate them to?
So I can't say we can link the side effects of emergency contraceptives to fibroids. Yeah. In a way, fibroids are like cancer. A lot of the time, they don't have any reason to come up, and then they do. It can be from hormonal imbalance. For them, it's like what you get is what you get, or however your system chooses to handle you. Okay. So I wouldn't link the contraceptives to the fibroids though. But yes, so the thing with contraceptives, they do have, a lot of these hormonal issues, hormonal drugs, for instance, they also do raise the blood pressure, for instance, especially in the women. So you can have that happening, especially if you are taking it consistently over a long period. Okay. It's implicated in that. Sometimes to those who have heartburns, those issues, sometimes it also aggravates it. Okay. So these are some of the side effects. But you see, the thing with emergency pills is they are not daily. In our system, some have taken them almost daily, but they are not to that extent where we are necessarily getting to see that side of it, as opposed to if it was a drug you were taking chronically, yes. But they do have side effects, and that's why they are labeled as emergency. But down here, we've decided to overlook the emergency on the labels.
They become daily pills.
Yes.
So I want to cook my own thing. So if I know that
Or
this root is good for malaria, I want to boil it myself and drink.
yourself, yeah.
I don't want to go and buy herbal medicine. No, I
Oh,
want to
that's
boil
instead.
myself, and then if this fruit is what I need, I want to have enough of that.
That is going to be finicky. I mean, it's all well and good,
Okay.
but you at home, you wouldn't be able to tell whether you've taken too much of it or you haven't. I didn't do herbal medicine either, so I
You
also
also
wouldn't
can
be
be
able
able
to
to-
tell if you've taken too much, you've taken too little. So in that case, in as much as you may want to do that, I would say it shouldn't be an everyday thing.
Okay.
And a little at a time. At least that's the advice I can give. Because at the end of the day, your kidney and your liver, they are at stake. And we know the situation with the renal clinics now.
You can afford.
So exactly.
You're dead and gone.
So in as much as you may want to rely more on that side, maybe if it's once a week, once every 2 weeks, you boil your herbs and take, fine. But I can't recommend you to do it every day. Because even I am not authorized in that space
To do
to,
that. So I
tell
asked
you.
this question because now on social media, you have people showing you all kinds of herbs and what you can use them for. And the idea is that because you're cooking them yourself, they are better off than you going out there to buy a herbal medication that obviously you don't even know whether what they say it is what it is. But they are showing you this herb does A, this herb does B, and if you put them together, you can actually do ABC for yourself. And that in itself comes as a challenge,
Yes.
because of, again, dosage is a problem.
Yeah, and that's another issue too with these things. I mean, they contain them all right, but then you should also think about how long it takes to discover a medication and put it out there. If it was that simple, we should have a lot more medications in the system. But it may be a particular ingredient in the plant that does what it's supposed to do. That's all right. I mean, we can't disprove that.
Yeah.
But it's about, for starters, how you extract it, how you
the
prepare.
quantity.
Exactly. So those are the fine details that will now question you cooking your herbs in your house.
Even the heat you apply to it.
Exactly. Who says it's the cooking it that will extract it? What if it's drying it? So those are all the questions you need to ask yourself.
Right.
So if you go online, definitely you see this plant contains this, and this. But as to how to extract it, to get it, to use it, and at what concentration, that is where the problem lies.
Right.
And I mean, even now in every field, I think TikTok, you learn everything about every field there.
Yeah.
But that's where you should know where to draw the line. I mean, social media, everyone is in their house teaching you.
That's true.
They have no authorization. So you should know where you take your information from.
Right.
It's not everything that you follow. So in as much as in the past, our parents, they'll boil the neem leaves and the rest. You can do that maybe once a week. You boil it, you drink it. But to make that your lifestyle, I will find you at Kolebu.
All right. What advice do you have for people who want to go into the space, become a pharmacist, make it a profession, probably do all that their whole life?
Yeah. Well, I mean, I wouldn't say it's a bad profession. I mean, it's definitely a good profession. You get to help people. It's definitely one of the best professions out there. Yeah. But what I would say is you need to be well informed about the system we are in. You need to take into consideration the current system. You know, in the past, there were very few pharmacies, very few pharmacists. But now we have a lot of pharmacies, a lot of schools are running pharmacy programs now. So every year, a lot of pharmacists are being churned out. So you have to take all that into consideration, getting employment in the system. I mean, but pharmacy is also multifaceted. So you have to choose the aspects you want to go in. So once you are well informed, you do your research. I mean, it's still a good profession. I do love the profession.
Okay.
That's one thing I never regretted throughout even my time in school. There was never a point where I felt like, oh, I wish I didn't do this, or I wish I did something else. I enjoyed the program. I've enjoyed my time in the space so far. So there's also definitely a lot to learn times change, things evolve. You learn more as you go. You choose, as you are in the system, you choose the field in the practice you want to focus on. I mean, I'm not supposed to see pharmacy as just community practice, but I mean, that's just one aspect. There are about 7 or more different fields you can go into, even in the pharmacy space. So it's just about being well informed. And then as you are going, you prepare your mind, I mean, for hardships. I mean, as of now in Ghana, everyone must prepare their mind for hardships. So. And then you choose which direction in the practice you want to go into.
All right.
So, yeah.
All right. Wrapping up, so I've known you as a pharmacist, then you now running a business that is far from what you do
Pharmacy,
from pharmacy, and then now switching a bit into IT. I also know you're pursuing a master's in public health.
Yeah.
Is it that the economy is putting you in that box, or you're just an ever learning person and you think that there's just so much out there that you could learn?
I would say it's a bit of both. I mean, thankfully, I've never been someone who has been fixated on being a particular thing in life.
Yeah.
So that is something that has worked for me. I'm open to anything so far as I can do it. Yeah. And so far as it's lucrative. I mean, we have to consider the economy. Yeah, exactly. Yeah, so, and that's one thing I like. So I'm open to learning new things, venturing into different areas. It can be monotonous if you are in just one thing your whole life. True. Yes. So I think it's good to broaden your perspective. I'm open to anything. I mean, even as at today, if something else comes out, you never know. The next time you meet me, I'm something else. So yeah, I'm open to everything.
Thank you very much. I think what I gather from everything that we've said so far is that, I mean, it's good to go to the hospital, see a pharmacist, stick to your medication, don't be like me.
Yeah.
And even herbal, if you want to do that very consciously. You'll go to an approved lab that produces herbal medication. And for the men who want to abuse contraceptives or for aphrodisiacs, I mean, you are also putting yourself at risk. Yeah. So thank you very much, Krista, for coming on.
Thank you for having me.
It's good having you. I'd love to have you again, and probably you'd have grown your business to something bigger than it is now.
Yeah,
you may probably have changed your mind about setting up a pharmacy. You probably
so that's the beauty of life. Yeah. So maybe the next time you see me.
All right. Thank you for coming on the ABC show.
Thank you for having me.
Bye.